Let's start here. South Africa has been dealt a significant blow in its vaccination drive. This, of course, following the suspected Johnson & Johnson vaccine contamination in the United States. Now, the company has been ordered to destroy millions of doses, including the 2 million doses which were finished and filled here in South Africa. But pharmaceutical company Aspen says in the coming week it's hoping to release more Johnson & Johnson vaccines that have not been impacted by the contamination, and it will deliver substantial quantities to replace the lost stock to ensure the vaccine initiative is maintained. This, of course, as the country prepares to start vaccinating people who are over 40 and those with comorbidities. eNCA's Barry Bateman takes a look.
2 million doses. That's the number of potentially life-saving one-dose vaccines that will be destroyed. But the manufacturing mishap occurred more than 3,000 kilometers away in Baltimore, in the United States. They're being stored at Aspen's facility in Gqeberha in the Eastern Cape. The impact will be felt locally on an already slow vaccine rollout.
I think it will, in the sense that we are now getting many more rollout sites around the country are up and ready to go. We need the vaccines to now go into them. So it will slow us up, undoubtedly, and that's why we're really looking for other sources.
But newly appointed Acting Health Minister Mamaloko Kubai-Ngubane says the current demand does not outstrip supply. She says in Gauteng in particular, which is recording more than half of the new infections in the third wave, vaccination sites have adequate supply. So far, about 1.7 million people have received the jab.
Will increase once they show signs of over-performance in terms of our numbers. Provinces that we have added on is Limpopo, and Western Cape has requested additional vaccines will be sent to them.
The minister is, however, concerned that the next phase of the vaccine rollout will be delayed, but she can't say for sure.
Because of the delay with the 2 million, we'll have to revise that and communicate in a week's time. The revised timetable, we are looking at whether we need to open for phase 2B.
Meanwhile, the country's relief might come from new products entirely.
SAPRA is currently busy evaluating the Sinovac as well as the Sputnik vaccine. These evaluations are at a very advanced stage of evaluation.
President Cyril Ramaphosa used his platform at the G7 meeting this weekend to reiterate his call for a vaccine patent waiver. US President Joe Biden has agreed to send some Pfizer vaccine donations to South Africa. Barry Bateman, Johannesburg.